first began to use willow bark. In 216 AD, willow became a common medicine used in the civilized world. In 1758, Rev. Edmund Stone is the first person consumed willow tree bark, and when he consumed willow tree bark, he found out that it elevated the patient's symptoms such as fever, temperature, aching limbs, and headache. And so began the modern age of the medicine use of willow. In 1829, Johann Buchner, a professor at the University of Munich, isolated a yellow substance from the tannins of willow tree that he named it salicin. In 1829, a pure crystalline form of salicin was isolated by Henry Rohan, a French pharmacist who then used it to treat rheumatism. In 1838, Raphael Pereira identified the chemical structure of salicin as this over here. Hart neutralized the salicylic acid by verifying it with sodium and acetyl chloride to create the acetylsalicylic acid. In 1863, Friedrich Bayer and Co. established. In 1876, John McLaren carried out the research into the effect of salicin, extra from willow bark, and the known anti-rheumatic treatment. In 1894, Felix Hoffmann joined the Friedrich Bayer and Co. In 1899, the Imperial Patent Office in Berlin registered Aspirin, the brand name for acetic salicylic acid, on behalf of the German pharmaceutical company Friedrich Bayer and Co.
In the early lifetime, Felix Hoffmann created a medicine called acetylsalicylate aspirin. Felix Hoffmann studied is about chemistry, pharmacy. In 1993, Felix Hoffmann graduated from the University of Madrid. Aspirin has two popular synthesized drugs, aspirin and heroin. All the ingredients that he uses from nature. Felix Hoffmann creatinine could be used in medicine. Felix Hoffmann got a reward in 1905. The reward is called the Nobel Prize in Chemistry. However, Felix Hoffmann has been left out because many people were saying that he was Jewish in 1930. In the early time, Felix by his own knowledge, he created aspirin worldwide. It has been a success. Felix Hoffmann becomes the head of the pharmaceutical marketing department. 2 years later, he was granted full power to attorney. Felix Hoffmann rediscovered have one main reason. Felix Hoffmann wants to live his father Untitled.
The use of aspirin. Aspirin is used to treat fever and pain such as toothaches, common headaches, and treat arthritis. And if you had clogged arteries, your doctor might have advised you to take aspirin in small quantities as it's a blood thinner and prevents blood clots. There are many good and bad things about the use of aspirin, like it increases the chance of survival after cancer but decreases the amount of iron in the body, causing anemia. It also helps in preventing strokes but also causes drug toxicity in the blood. Aspirin do to your body. Aspirin is a salicylate and a non-steroidal anti-inflammatory drug, NSAID. It blocks certain natural substances in your body to reduce pain and swelling. If you're giving it to your child below 12 years of age, do consult a doctor. Aspirin acts at the site of damaged tissue to block the start of the nerve signal to the brain. This mechanism by which we experience pain. It does this by inhibiting the formation of prostaglandin, which is the active agent responsible for the sensitization of the nerve ending. Prostaglandins are responsible for a lot of psychological events in addition to the start of the pain signal at the nerve endings. For example, they're responsible for inflammatory fever and clotting of platelets in the blood. So it's easy to see why aspirin is such a useful drug. Thank you.
How aspirin works. Let's see. Aspirin, also known as acid, SAS for short, is a medication used to treat pain, fever, or inflammation due to its action of prostaglandin system. People who have already had heart attacks or stroke, taking aspirin for 2 years non-stop will prevent 1 in 50 from having heart attacks again. Aspirin works to prevent heart attacks and strokes by reducing the production of thromboxane, a chemical that makes pellets sticky. When aspirin works as it should, pellets make less thromboxane and are less likely to form a blood clot that could block an artery. It prevents the production of pain messenger called prostaglandins in the body, inhibiting COX-1 and COX-2, which are needed to produce prostaglandins.
If you get any of these side effects, you should go to a doctor. So the most common side effects of aspirin is coughing out blood, vomiting, stomach pain, fever, and hearing problems sometimes. The less common side effects of aspirin are change in consciousness, confusion, dark urine, and a lot of other stuff. But these are just the less common ones, so you'll probably never get them. And if you get any of these, you should definitely go to the doctor.
Aspirin tablets consist about 90% of acyclic acid, with a minor amount of insert filters and binders. It's pretty simple to make because they made it a long time ago. So a long time ago, it's pretty simple to make.
I know it's a big word, right? So now I'm going to break it down. Pain from an injury to anything but the nervous system is called nociceptive pain. After specialized sensory nerves located throughout your body called nociceptor, it will send signal to your brain. When you are injured, prostaglandins make your nociceptor increase the signal to your brain. And most of the time, the pain that your body creates is actually good because it tells you there is a problem in your body. Prostaglandins are also one of the chemicals that cause inflammation in the tissue around the wound. They make your blood vessel expand, flooding the damaged tissue with all the immune system stuff your body sends to protect the wound from infection and to help it heal. When you take aspirin, it absorbed by your digestive tract into your bloodstream, which take it throughout your body, including places where cells are excreting the enzyme necessary to produce the prostaglandins. Molecule of aspirin lock up with one of those enzymes, cyclooxygenase 2. Once the molecule of the cyclooxygenase 2 is locked into the molecule of aspirin, it can help to create prostaglandins, which means fewer prostaglandins are made, which means that pain signal to your brain don't increase as much and the tissue in the area doesn't swell as much. Cardiovascular disease is a leading cause of death in the US and Western Europe, but regular use of preventive low-dose aspirin has proven effective in preventing CVD events. A good thing to use aspirin is that it reduces the deaths from CVD in the US and Western Europe. Also, increase the impact on economy if the use of aspirin increased. It saved up $79.6 million for primary prevention and $32 million for secondary, and additional out-of-pocket expense to the patient of $29 million for primary prevention and $2.6 million for secondary prevention for the cost of aspirin. Currently, each year the world consumes more than 40,000 tons of this drug. But despite a solid age, aspirin is still fraught with secrets. Many people have dizziness and stomachache due to the side effect of aspirin. Although a large group of people are taking in aspirin pills, a few know how much they need to take it.